It kind of depends on what the trigger is. So most people with Hashimoto's will have blood sugar issues. So your blood sugar could be too high. It could be too low. It could be both in a day that makes you have anxiety. You might not be eating enough protein. Often with Hashimoto's, women have a hard time digesting meats because their acid levels are really affected by the level of thyroid hormone that they produce. So that can be something that's really common, and that can also contribute to an iron deficiency. So these are things to consider. Having gluten in your diet can make you feel anxious. Having dairy in your diet might make you feel anxious. So those are things to kind of consider, like, does it make sense for you to get off of gluten and dairy for a little while? Maybe get on a paleo diet. These are some things that I would start with. That's where I actually start with my autoimmune reset program with my patients that I go through my 12-week program. Is we work on protein, and then we work on digesting the protein, and then we figure out how to get the inflammation down. Because sometimes just the general inflammation from Hashimoto's will cause your brain to feel inflamed, and that makes you feel anxious as well. So this is something that we have to kind of tackle and tangle and to untangle and try to figure out person by person. But it's not impossible. And if you want to join us on our reset program, it's pretty fun to try to figure out everything on your body. I'd love to work with you. Just DM me or get on my Calendly. It's calendly.com/Dr. Darla Booth. So if you want to hop in and learn some more, we do some really serious coaching about this, and we can help to get your Hashimoto's just under control.